All right, due to the just kind of limited time that we have here, we're going to go ahead and get started as people continue to kind of filter in here. So, first and foremost, I'd like to thank you all so much for being with us this afternoon for our second of 5 so far scheduled town halls for the Paid Family and Medical Leave Insurance Program. We really appreciate all of you for taking time today to join us to help identify issues, offer some ideas, raise concerns you may have, or just make suggestions relating to the program's development. And you'll see that there are a number of us here with the PFMLI program. So with us, we have our equivalent plans work group lead, Caitlin Critton, as well as Christy Honanen with also our equivalent plans work group, our benefits work group lead, Rick Heineken, our contributions work group lead, Kelly Ofoni, Jason Booley with our communications team, and then Lois Williams and Lily Hogue with the PFMLI leadership team. So thank you all for being with us today. So we're going to start today with just a brief introduction of the PFMLI program by our policy manager, Lois Williams. Caitlin will then provide an update on where the program is when it comes to equivalent plans. Now, once Caitlin is done, we're going to go ahead and open this town hall up for questions or comments. We did have a number of people that went ahead and sent us their questions before the town hall. We also had a number of equivalent plan questions that were asked during our contributions town hall that took place earlier this month. We're going to go ahead and address those first, and then we'll move on to those that were submitted during the meeting. Now, since today's session is intended to focus mostly on equivalent plans, and because we are limited, we may filter some questions related to other topics and address those during other sessions, but we'll get to as many of them today as possible. Now, if you missed the contributions town hall, or if you have a contributions question, please feel free to go and check out that. That was a recording, and that is on the PFMLI website under the town hall tab. Now, how can you submit your questions with us today? If you have any questions or comments or concerns or anything, you can use the question and answer tab that there is at the bottom of this screen. Please feel free to submit them during any time during this meeting, and again, using the Q&A tab there at the bottom of your screen. Now, we do have some that are with us today using and calling in using phone. So if you're listening and participating by phone, you can email your questions to paidfamilyandmedicalleave@oregon.gov. Now, just as our contributions town hall, this town hall session is also being recorded and will be posted to the PFMLI webpage within a few days following this event. Now, one thing that I really do want to emphasize is that because PFMLI is still very much in its early stages, this is our second virtual town hall, it's still being developed. There could be a lot of questions that we just don't have the answers to at this time, and it could be a little time before we have answers to those questions. We're really utilizing and using this time to really listen to you, gather questions, comment, or concerns that will really help us build and implement a program that works for all Oregonians. So with that, again, thank you all so much for coming today. And with that, I'm going to go ahead and turn it over to Lois Williams, who's going to provide just a brief introduction on the PFMLI program. Lois?
Great. Thank you so much, Dean. Well, just thank you everyone for joining us today. We are very excited to hear your input, and that means questions, comments, or concerns so that we can start addressing them. Your questions are going to help us identify areas that we need to delve into further in order to provide guidance with better education and outreach a year from now, right before we go live with the contributions portion of the program. I'm going to quickly provide an overview of the new program. I won't cover every detail, but this will give you an overview. So most countries around the world have paid family leave programs of some kind. The United States is one of only a few that don't offer this type of leave at the national level. So Oregon's Paid Family and Medical Leave Insurance Program was passed into law in 2019. Oregon is joining only 8 other states plus Washington, D.C. in offering such a program. Of those other states that have paid family leave programs, the first 4 evolved from those states' existing disability insurance programs. Of the states with more recently enacted programs, Washington's plan began paying benefits earlier this year, and then along with Washington, D.C. this summer. Massachusetts and Connecticut will each follow in the next couple of years, and then Oregon's program will start paying benefits beginning in January of 2023. This next slide will show you that when the House bill was passed in 2005, or when House Bill 2005 was passed in 2019, it contained certain timelines. And so some of those timelines are that it became effective in September of 2019 and requires the Employment Department to provide periodic reports to the legislature on how the implementation is going at various stages. So this slide shows some of those timelines. But other timelines included are that the department is to have as many rules as possible as needed to establish the program in place and adopted by September of 2021. So that's not that far away from now. We're already less than a year away from that date. Also, the contributions that both employers and employees pay into the program will begin to be collected in January of 2022. That's only just over a year from now. And then the benefits will be available to claimants beginning a year later in January of 2023. The legislature funded the implementation of a program with a general fund loan. That loan needs to be paid back in January of 2023, and the program will be self-funded from that point forward through the Paid Family Medical Leave Fund that all the contributions are paid into. So that fund will pay for the benefits for people claiming paid leave. It will also pay for the department's expenses to administer the program. The program itself provides 3 types of leave. There's family leave, which provides paid time off to bond with a child during the first year after birth, adoption, or foster care placement, as well as to care for a family member with a serious health condition. The next type of leave is medical leave, which provides paid time off for your own serious health condition. And then safe leave, which provides paid time off to respond to issues relating to domestic violence, harassment, stalking, or sexual assault. Now, here are some of the aspects of Oregon's program. Eligible employees will be able to take 12 weeks of paid leave. They may take 2 more weeks of paid leave for pregnancy, childbirth, or related conditions. Employees may take an additional 4 weeks of unpaid leave for events that are also covered under Oregon's Family Leave Act, known as OFLA. So there's a lot of overlap, but there's a lot of items that don't overlap between OFLA and paid family medical leave. The weekly benefit amount is based on an eligible employee's prior earnings from a base year or an alternate base year. Employees who made average earnings up to 65% of the state's average weekly wage are going to receive full wage replacement. Employees who made more than 65% of the state's average weekly wage will receive an additional amount, but benefits are going to be capped at a maximum of 120% of the statewide average weekly wage. There's also a minimum benefit amount equal to 5% of the statewide average weekly wage. Several job protections are included in the program. For example, at the time that an employee returns from taking paid leave, they must be returned to an equivalent position. Also, their seniority is not affected and cannot be affected by taking the leave. Employers may not discriminate against an employee who inquires about taking paid family medical leave or who actually takes paid family leave. While someone is out on paid leave, employers must continue to provide their health care benefits. So if they had health care benefits before, those should be continued to be covered while the employee is on paid leave. So both employers and employees are going to make contributions into the program starting in January 2022. So those contributions will go in for a whole year to help fund the plan before benefits will start being paid out a year later in January of 2023. Employee wages up to a maximum of $132,900 per year are subject to the contributions, and that maximum is indexed for inflation each year. So the contribution rate itself is the same for all employers, and it's going to be set each year, once a year, by the employment department. And it is capped at no more than 1% of wages. Now, we have an actuarial on staff right now who is working up those projections, and she will help us determine and set that rate, and then we will notify employers of what that rate is. But again, it is capped at no more than 1% of wages. Now, of that 1%, contributions are split between employees who will pay 60% of that up to 1% rate, and employers who will pay 40% of that rate. So it is a split on how much people pay. Small employers, which are those who have less than 25 employees, do not have to pay their employer portion of contributions. There's going to be more to come on this on the next slide. They still must participate by withholding from their employees, but their portion doesn't have to be paid. Now, this particular piece of legislation did provide an opportunity or an alternative for employers who want to have their own plan rather than participate in the state plan. If they choose that route, their plan must provide at least the same benefits as the state plan, or better. Employers have to apply for approval of that plan, and they have to pay a $250 fee, up to a $250 fee to the department to go through a process where we can validate and verify that their plan does provide equivalent benefits, equivalent or better. These employers and their employees will not pay contributions into the state plan, but instead they'll contribute to their employers or that employer's own plan. Benefits for those employees are going to be paid out under that employer's equivalent plan. We are currently working on administrative rules for situations where workers have more than one job with potentially 2 or more different types of coverage or plans. Maybe an equivalent plan under one employer and then a state plan under a different employer. Or where maybe a worker just has 2 jobs and each employer has their own equivalent plan. We're calling those crossover or simultaneous coverage situations, and we are taking a look at several issues around those. On the prior slide, I mentioned that small employers, again, those with fewer than 25 employees, can choose not to pay the employer's 40% share of the contribution. But if they do pay that portion, though, they can apply for small employer assistance grants that can help offset the cost of hiring temporary replacement workers or other related costs while someone is out on leave, like maybe paying overtime for the other employees who are picking up extra work while that person is out. The grants are up to $3,000 each and can be requested for up to 10 employee leaves per year. House Bill 2005 did also include a requirement for the department to establish an advisory committee. Their role is to advise the director and the department on implementation, administration, and rulemaking for the new paid family medical leave program. They consist of 9 members. There is one from the employment department, our paid family medical leave director, who chairs the committee, and then 4 individuals who represent employee interests and 4 individuals who represent employer interests, one of which represents small employers. Now, this group has been meeting for almost a year now, and they're meeting monthly, and they have provided us with very valuable input, and they continue to do so. With their help, we've established 5 work groups to bring in even more perspectives and delving into particular topics within the program. So our first group was, in fact, the equivalent plans work group. They've been discussing how that application process will work, along with identifying processes for renewing the plan every year, possibly withdrawing it if they choose to end the plan, or in some situations terminating an equivalent plan. They're also going to discuss what reporting processes those employers will be asked to do, and they will help develop rules for when disputes arise between employees and employers with equivalent plans. Another one of our work groups is the contributions work group. They are exploring exactly who must make contributions, how to define the wages, and how employers will report their information and submit their payments. They're also going to take a look at areas involving the sale or transfer of a business and interest and penalty issues. Say if an employer does report, but perhaps they didn't make full payment, there will be some interest involved there, and potentially penalties if employers aren't filing as they should. Another group is really focusing in on the small employers work group. They're taking a look at determining how to count employees, when to count employees. Remember, because small employers are defined as those with fewer than 25 employees. And because you can have part-time and full-time and seasonal, we want to make sure that people have a very easy way to identify if they are a small employer for purposes of this program. This group is also clarifying the job protection provisions I previously talked about continuing of health benefits and being restored to an equivalent job when someone returns, or making sure that employees are notified of the type of plan to which their employer has covered them. And then the last area for this small employers work group is developing that whole assistance grant process. What is it going to look like to apply for a grant? What has to be provided? And how can we get that grant out to that employer? And then another work group is focused around self-employed individuals or independent contractors. The law, I didn't mention this earlier, but the law doesn't necessarily cover these individuals. They may make an election to join in and have coverage. They have to join for 3 years, but they are allowed to obtain coverage. They must participate for at least 3 years, and their contributions are going to be based on their taxable income. Again, remember, they're self-employed, so they don't really have wages. And so we're coming up with a calculation comparable, but that is based on taxable income. So that work group is exploring those. And then the last work group that I'll mention today is the benefits work group. They're taking a look at everything related to eligibility, applying for benefits, the computation or calculation of benefits itself, payment of benefits, and then issues also related to such as intermittent leave. Maybe someone doesn't want to take a full 12 or 14 weeks off. Maybe they plan instead, or because of the nature of their leave, they need to take a day off and then 2 days off. And so it could be intermittent leave. So this work group will be taking a look at those types of situations. So before I turn this now over to Caitlin for more details about the topic of equivalent plans specifically, because she's the team lead for that group, I just want to thank you again for participating today. We are going to be capturing all of your input here, but I know you'll have additional opportunities in the future to provide more comments. As we start drafting the administrative rules, we will be posting them online starting in a couple of months, and we will be sending communications out inviting you to take a look at those draft rules and give us comments, feedback, questions, etc., so that before we go to a more formal finalizing rules process in the spring and summer next year, we can get your early stakeholder input. So thank you very much. I'll turn it over to Caitlin now.
Thank you, Lois, and thanks so much for providing such a great overview of PFMLI and the requirements established in law for equivalent plans. As Lois mentioned, Oregon's law offers employers the opportunity to apply for an approved equivalent plan to their employees rather than participate in the state plan. Employers will have the option to provide a plan either through self-funding themselves or by partnering with an insurance carrier to operate their equivalent plan. But it is worth noting that regardless of the method used to manage the equivalent plan, the employer still carries the legal burden of satisfying the requirements for the program, and it's the employer who would be required to submit the application for approval of the equivalent plan initially. Our work group launched this June, and we have members representing both employer and employee perspectives, as well as members from 2 insurance companies. While the statute itself provides an overview of the basic requirements for equivalent plans, there's a lot of process and policy development that we still must do over the next year prior to launching the equivalent plan application process. So we've divided our work into 4 priority areas, and within each area, we're focusing on the most important aspects first in order to meet our timeline. and to make sure that employers have a sufficient time frame to develop an equivalent plan if desired, or to make changes or modifications as necessary to utilize an equivalent plan that they might already have in place. We started our work by focusing on the policy questions around the application for approval of the plan, department review of the application, appeals, and simultaneous coverage situations that Lois described earlier. And we've continued to focus our work to include employer appeals of department decisions related to an application's plan's denial, the portability of benefits for employees, reporting and record keeping requirements, dispute resolution between employees and employers with equivalent plans, as well as frequently asked questions and the employer guidebook that we plan to offer. Our next priority is to look at policies relating to payroll deductions and quarterly reporting and payments, which we are just getting started with. I do want to thank you guys all for being here with us today. I'm looking forward to hearing your thoughts and input in addition to the questions that you might have. And hopefully we'll be able to answer some of your questions as well during this time today.
Lois and Caitlin, thank you so much for that brief overview on the PFMLI as well as the equivalent plans work group. And so we're going to go ahead and dive into those questions that have already been submitted either ahead of time to the Paid Family Medical Leave at Oregon.gov or those that were brought up during contributions. And so a lot of these directed to Caitlin, as again, the topic of today's discussion is on equivalent plans. And so Caitlin, one of the first questions that was asked was, we'd like to draft and begin administering our own program prior to this going into effect. Is there any guidance / support we could utilize?
Thank you, Dean. That was a great question. We're currently in the process of establishing the administrative rules relating to the equivalent plans, as we described earlier. And as we do so, we're going to be providing additional guidance and supporting documents for employers to use while developing equivalent plans. These documents will include checklists, employer guidebooks, and FAQs, which will all be available on the website. We're hoping to provide the information as quickly as possible so that employers have an understanding of the requirements that are needed to participate in the program. Because even if you have a plan now, you'll still need to apply to the department to have that plan approved prior to January 1st, 2022, when the plan must have been approved before it goes into effect. And then one additional clear piece of guidance is that the benefits and the duration of leave afforded to your employees must be equal to or greater than the benefits and duration of leave offered in the state's plan. And so those requirements are articulated in the statute and were provided in the overview today from Lois. And so we anticipate that you guys can also look at those just as those basic requirements to know that you're meeting as you're setting up your plan. We do think that the application process is going to go live in the fall of 2021, so about a year from now, just to make sure that all employers have enough time to get that plan approved before January 2022.
Caitlin, thanks so much. Another question for you is, what will equivalent plans look like? Will something as simple as accrued PTO qualify, or is this a more involved program?
Thank you. We're certain that the benefits afforded to employees must be equal to or greater than the benefits and the duration of leave under the state's plan. So an accrued PTO program will most likely not meet those requirements. Accrued PTO could be used in addition to the program, but it couldn't be provided in lieu of it.
Thanks, Caitlin. A two-part question here. The first part being, if the employer is on an equivalent plan, is the employer still required to withhold this 60% employee portion?
Okay, thank you. No, employers are not required to withhold the employee portion of the contribution, but they may choose to.
And the second part of that question is, if an equivalent plan is to be used, is there a rule or limitation on the premium amount that the employee has to contribute? And then they actually put an example out there of Connecticut. They say is the private plan cost to the employer cannot be greater than the state plan.
Yeah, so that would be the same then for Oregon as well. The cost to the employees under an equivalent plan cannot be greater than they would be in the state plan. And so employers, like I said previously, they're not required to withhold the employee portion of the contribution. And an employer may assume all or part of the costs associated with an approved equivalent plan. If the employer chooses to withhold contributions to help fund their equivalent plan, they can't be any more than would be under the state plan. And additionally, the statute explains that the contributions retained by an employer for an equivalent plan, they must only be used to expense for those plans' expenses, and they're not considered a part of the employer's assets for any purpose.
Caitlin, thanks so much. Now, one question that has come up quite a bit, we've gotten a couple emails, and this did come up during our contributions, was similarities between short-term disability and the PFMLI program.
Thank you. Yeah, this question is, it's a little tricky, and I think a lot of people are familiar with short-term disability plans with various employers. And so to answer this one, Oregon's paid family and medical leave insurance provides benefits to covered individuals when they need to take leave from employment due to family leave, medical leave, or safe leave, those three types that Lois described earlier. Short-term disability typically only covers injuries and illnesses that render an individual unable to do their job for a short period of time. So short-term disability might overlap with the medical leave aspect of PFMLI, but it doesn't typically cover the family leave or the safe leave that is provided under our law. And so additionally, paid family medical leave insurance medical leave is specifically for serious health conditions or pregnancies. So some of the less serious medical conditions that might be covered under a short-term disability plan, they may not be covered under PFMLI. So there are some similarities, but also a lot of differences between the two.
Caitlin, another one, and Lois kind of touched a little bit on this during her presentation on PFMLI, but what will happen for workers who leave employers with equivalent plans and then have a need for PFMLI?
Yeah, so the statute allows for a portability of benefits, and we have just started our research into what exactly that means or looks like. But generally, our understanding of the statute is that if an employee leaves an employer with an equivalent plan and begins employment with an employer who has been providing coverage under the state plan, that employee would be immediately covered under the state plan with their new employer. But we have a lot of questions about this topic, and so we'll be continuing to research and figure out the specifics as we move forward.
Caitlin, thanks so much. Kind of a clarification from someone that submitted a question. They were curious on, which employees qualify. Employees that are employed for 30 days. They'd also said that they read somewhere where employees have to have made over 1,000 in the previous year. So they were curious if we could just kind of clarify that up for them.
Yeah, thank you. The statute has slightly different requirements listed out for coverage under an equivalent plan versus the state plan. And so the state plan requires that an employee must have earned $1,000 in wages in their base year to be eligible for benefits under the state plan. And that's $1,000 in wages from any of their employers that were in the base year combined. And the statute for equivalent plans, it requires that employers provide or they make the plan available to all employees who have been continuously employed with that employer for 30 days. So there's a slight difference there in the language, so it can get a little confusing as we're speaking about the two together.
Another question, Caitlin, for you that was kind of regarding, multiple different employers, and it's kind of a three-part question, and they were wondering if I work for two or more employers, each with their own employer-offered plan, first part being A, will I have to fill out multiple applications to apply for benefits?
Okay, thank you. So that is a great question. And it's something that our team is currently wrestling with this, and we've been working with our work group members as well around this, but we don't have the specifics yet determined around this particular question. And so for me, at least, the fact that it's being asked really highlights the issue that we really need to make this a priority, and it's a very important issue because a lot of employees do have multiple jobs, and so we're focusing on these right now as we speak.
A second part of that question: who reviews my eligibility for benefits? The department, my employer, employers, and insurance company.
So without saying the same exact answer again, that is a great question, and we do not have the answers for it yet. But it will be It will be one of those three. Most likely it would be, it's going to be one of those three, the department, the employer, or an insurance company. But we have to figure that one out soon. So that will be coming.
And then the final part of that is, how will I get my benefits from multiple plans?
And again, that one's going to be that same answer. It's a fabulous question. It's going to be tricky with the way that the statute calls out the specific rules around this and the fact that employees can be covered by multiple plans at the same time. And so we're working on this one, and we will come back hopefully soon with some decisions, or at least potential answers. I do want to highlight that we talked earlier that the Q&A can be used for input as well. And so because this is such an important issue, if anyone does have input, please put those in the Q&A as well, or feel free to email us to share your thoughts around maybe what the best answer would be for this question.
Thanks, Caitlin. And so this one, kind of from an employee standpoint, what recourse do I have if my employer or the insurance company denies my claim under an equivalent plan?
Yes. So the law requires that the department has to establish a method to resolve disputes between employees and the employers with equivalent plans concerning the benefits and coverage. So we're currently working on determining what that process will look like, but there will be a process in place for employees to deal with these situations when or if they occur.
Kind of a question along the same lines there, Caitlin. How will the department guard against employers on third-party providers who are trying to deny claims to save money and or to keep employees from taking time off under this law?
Yeah, thank you, Dean. So we do know that a lot of employers and third-party providers want to treat their employees well and fairly, and they will do all that they can to help their employees during the challenging times when employees are faced with these situations when they need to take leave. The law does require that employers provide information about their plans to their employees. So hopefully the employees will have all the knowledge and know what they're covered for and the processes and procedures to take leave. The law also clarifies that employers cannot discriminate against employees who inquire about or take paid leave. And additionally, like I mentioned earlier, the law directs the department to write rules to help resolve disputes between employees and employers. And so when it gets to the end, if there is a situation to where this is occurring, there will be a process for disputes to take place.
Thank you, Caitlin. And another one being, will there be a point of contact at the department to help employers navigate a claim or issue with an equivalent plan, and will help be provided in multiple languages?
So this one's a really great question. And for me, it really highlights, it's a great example of the input that is helpful to the department during this time. And so we're currently discussing what support will be offered through the department and what that will look like for employees that are covered under equivalent plans. But we do know that any support offered from the department is already offered in multiple languages. So we can be certain that whatever is offered will be offered in multiple languages for PFMLI as well.
Thanks, Caitlin. And then what actions will the department take if it becomes clear that an equivalent plan is not truly equivalent to the state plan?
So we have not yet started our work on the department termination of non-compliant plans or our work researching what the periodic review of approved plans is going to look like. But those are both topics that we will soon be tackling, and they're both authorized in the law. We will be working on both of these issues to make sure that employers are providing approved plans that are truly offering benefits and leave durations that are equivalent to the state plan. If upon review, the department does determine that a plan is not compliant with the requirements for equivalent plans, the plan will be terminated and both the employer and the employees will revert to the state plan. We don't yet know if there will be an opportunity during that review process or what that department review will look like for employers to correct the problem or to then provide those equivalent benefits during that review process prior to a termination. But we're going to be researching that, and there will be administrative rules and processes around this topic to come.
Caitlin, thanks so much. This next question is for Rick. He is our benefits work group lead. And Rick, A key component of the program is providing coverage for all Oregon families, including those with diverse family structures. How will the agency ensure that equivalent plans cannot require burdensome and complicated familial verification processes for the families?
Thank you very much, Dean. Yeah, Oregon's new law provides some of the broadest definitions of family members that any state's PFMLI program has to date. The law lists numerous relatives such as spouse, child, parent, siblings, and many others, but also individuals related by blood or affinity whose close association with a covered individual is the equivalent of a family relationship. So, our benefits work group has been discussing how such a relationship can work and how it should be verified. And so far, we've reached the conclusion that the intent of the law is to allow employees with diverse family structures to take the leave to which they're entitled without requiring any burdensome or complicated relationship verification process for anyone. So rather than do that, we are looking at other verification requirements that may be more appropriate for the other aspects of the program, such as to validate a serious health condition or the need to take safe leave. I want to thank you very much for this question and remind you that the equivalent plan employers should also not impose more burdensome or complicated verification processes than those that we are requiring under the state plan. So we're looking at how we're going to be enforcing that.
Rick, thanks so much. And Caitlin, the last question that was submitted to us either during the contributions town hall as well as into our inboxes, if I move from an employer that had to provide a plan to a new employer, why I'll be eligible for benefits. And then a second part of that is how will the department know that I was previously covered under an employer plan?
Okay, thank you, Dean. So just to clarify, I'm going to clarify on this question really quick. If I move from an employer that had a private plan to a new employer, will I be eligible for benefits?
Yes, that's correct.
Okay, perfect. And then how, okay. So like I mentioned in an earlier question, we're just getting started on the research around the portability of benefits that is authorized within the law. But we do know that if an employee has coverage under an equivalent plan and they move to a new job, the employee will immediately gain coverage under the state plan or under a new equivalent plan if their job has that. The law doesn't include any details or specifics about if there are timeframes that apply after leaving a job. So we will continue to do more work around that issue and just determining those specific rules that might apply or those different cases with different employees. As for the second part of this question, how will the department know if I was previously covered under an employer plan? We anticipate that employers with equivalent plans will be required to report information about the employees that they're covering. But again, we don't yet have the details about that reporting process figured out yet. So that will be to come as well.
Well, Caitlin, thank you so much. I'm going to now go ahead and turn this over to Lily Hogue with our PFMLI leadership team. She's been monitoring all of the questions that have been submitted so far in that Q&A tab there at the bottom. And again, please feel free to submit any questions that you have using that Q&A there at the bottom of the screen. So she'll be facilitating all of those questions that have come in. Lily?
Hi. Hey, I'm Lily. Y'all have some really, really great questions here. So I just wanted to remind folks that if we don't get to all of them today, we're absolutely recording the Q&A here. We're also open, you can always contact our department through the email that's listed in the chat. And we're going to keep having town halls like this throughout the next year. So this isn't your one and only opportunity. And I'm saying that because you have a lot of great questions. So the first one I actually wanted to ask Caitlin, I'm going to send you quite a few here. Can you just tell, will employers with equivalent plans have the same reporting requirements as employers with the state plan? And if not, how will they be audited to confirm they're offering equal to or better than plans?
Thank you. So I think I mentioned both of those are kind of under those categories that we haven't fully finished our research and our analysis about what the statute says, but we are anticipating that employers will be providing reporting along the same timeframes as employers with the state plan. And so with that second part of that question, I think that we will know because there will be reporting requirements for employers with equivalent plans.
Thank you. And will you have, we had some folks ask, this is sort of a two-part question. One, will we have sample plans? And then sort of on top of that, there were some questions about like if an insurer provides a sample plan, is that the kind of thing that we're going to end up approving and allowing folks to use? How will that work?
Yeah, thank you. Those are great questions. We don't for sure have the answers yet on those ones either, but we are starting to look into what that looks like. And we know that from looking into other states and the way that they have done things, some states have chosen to approve generic or kind of plan templates from insurance companies or agencies so that an employer knows ahead of time if that plan offered by an insurance agency has been approved. We do anticipate and we're planning that regardless of if the plan has been approved by an insurance company, the employer is still going to have to apply for approval of their equivalent plan. So it's not going to take that step out of the picture for employers. And we still, again, don't know for sure if we're going to be doing those generic plans or approving them, but we are going to be tackling that issue to come here soon.
Thank you. I have one for you, and then after that, I think it'll be for Kelly. So there's some confusion about how who's funding this. So this is a sort of two-part question again. So the state plan, can you remind us of how that works, and then how it will be funded if you have an equivalent plan? Who's responsible for paying and how they keep that money, or how they fund it?
Yes, I think I can answer that. So with the state plan, both the employers and the employees are contributing to the state through the contribution amounts that are set out. The statute has the specific limits, and then it has the 60% of and 40% of for employees and employers. So that's the state plan. That's how that plan is funded through the contributions. Equivalent plans are funded by the employer. And I mentioned earlier, they have the choice to withhold contributions or not, but they will be fully funding that plan then on their own and with the contributions that they would be withholding that can't be greater than the contributions that would be withheld from an employee under the state plan.
Okay, so for clarification, and this kind of links to someone else's question.
Yeah.
So so somebody else sort of asked on top of that, does that mean that if they're at a small employer that has an equivalent plan, does the employee pay 100%? Or how does it work?
Yeah, so the answer for that one would be no. So if an employer is at an equivalent or at a small employer is wanting to fund an equivalent plan, they still would not be able to withhold any more than the state would for their employees. And so the small employer would need to be contributing something most likely in order to their plan to make it possible to have an equivalent plan.
Okay, thank you. And actually this question is not for Kelly, it's for Lois. So apologies. If the employee moves to another state like Washington, but they've been paying into an equivalent plan here, does that money transfer over to the new state or employer? Or even if they've been paying into the state program here?
That's a really good question. When we talk about who has to pay in as an employee, it's based on wages for services performed in Oregon. It's really for people who work mainly in Oregon. If they have a little bit of incidental time outside of Oregon, it still counts. It's Oregon wages. Doesn't matter where they live. So if someone moves out of state and leaves their job, they're not going to have that coverage anymore. Just because you've paid in for the last 5 years doesn't mean once you've left the state and left that job, it's not like you have a bank account built up. That all went into the big fund that pays for the program for everyone. But let's say that you live in Portland and you have a job in Oregon where you perform services, and you just happen to move over to Vancouver and buy a house in Vancouver, and you're still coming into Oregon every day to do that's where your job is. You're still employed and you're performing services in Oregon, then you're covered. Even though you physically moved out of the state for your residence, your job is still in Oregon, so you are still covered. And I will ask Kelly if there's anything she wants to add, because the contributions work group has been taking a look at that.
Thank you. I don't specifically. It's an important topic about how wages work when people work in different locations, when they move. There's a lot of questions around it, and it's something we're starting to really focus on right now. So hopefully in the not too distant future, we'll have more clarification on kind of the nuances of how wages work with different states, for example.
Thank you. Caitlin, I have a bunch more for you. So we're getting a lot of questions about paperwork and documentation from employers and employees. So if you have an equivalent plan, will they fill out what are similar to OFLA and FEMLA forms? Will the employee fill them out? Will they submit them to each employer individually? Who's responsible for that part of the paperwork?
Thank you. That ties to some of those questions that we had earlier that we just don't fully have figured out yet, but we're working on them. We kind of have a few options that we're wrestling with in the sense of an employee applying for benefits under their equivalent plan. And it seems like all the states so far do things a little bit differently in how that is processed of other states that have PFMLI programs. And so we're really working to weigh all the options and figure out what is going to work best for the employees and the employers in these situations. So if you have a great idea or a thought on what will work best, please do email us for that, because we're working on this one right now.
So what about employers who choose to go on the state plan? We have a question, and then they decide they no longer, or sorry, they choose to have an equivalent plan, and then they decide they want to get on the state plan, or vice versa. Can they switch within the year, every year, anytime they'd like? How will that work?
Yeah, thank you. So they do have a year requirement or a year commitment. They're applying for their plan to be covered for a year. When they've completed that year, then they could withdraw their plan and move to the state plan instead if they would like to. There are some additional rules within the statute about those contributions that they might have withheld during that time. So if they had a plan for a year, withheld contributions, and didn't use those contributions for PFMLI leave that was needing to be taken, or for their employees or the management of the plan, there is mention in the statute that we do need to create rules around what happens to those funds. So I would say that that's something to think about as well if you're potentially wanting to try one way or the other and move back and forth, is when we get all that figured out, you'll want to pay attention to those specific pieces.
That actually goes perfectly into this other question someone had, which is if somebody is self-funding, so if an employee is putting money into the fund at their equivalent plan and then the employee quits, what happens to their contributions?
Yeah, and that one ties kind of to the same thing that Lois said about employees who move out of state or who, leave plans in that. Am I good, Lily? Can you hear? Yeah. Okay. I'm getting nods. Sorry. So that one plays into the same question that Lois answered of when employees move out of state or change plans. There isn't a fund at that equivalent plan that's tied to that particular employee that then transfers with them. They are these funds that are, the money is pooled together and leave is taken as needed. And so the only thing that happens for employees when they leave plans or quit an employer is there is that portability of benefits, in that their eligibility should start automatically if they move to a new job with an equivalent plan or to a job under the state plan. But there isn't a tie from the employee to the exact funds that have been withheld for their contributions.
Thank you. This one's actually going to be, I think, this one's going to go to Rick, actually. We had a question up top, actually, about the health premiums and maintaining health insurance during leave. They were asking, so then who's responsible for health premiums and paying other benefits while folks are on leave?
It's a very good question, and it's one that we don't have an answer to yet. But it's probably we're going to be looking at a lot of that information as we start having conversations with job protections and the Bureau of Labor and Industries. So we can try to figure out exactly what will be covered, what should be covered, what should change for employees while they are off for PFMLI. Right now, we don't have a strict answer on it yet, but it is something we are going to be looking at as we move forward. There's a lot of job protections that are going to be there, and we need to lay them out to make sure that employers and employees know what their rights are.
And we do know that under the law, when people take leave, they're required to maintain their health insurance.
Yeah.
And at whatever so whatever the employee was paying previous to the leave and the employer was paying, they're supposed to maintain the same level of benefits. So if the employee paid partial share, they will still pay part of that, but they are required to maintain healthcare benefits. On the other pieces, we are working out the rules. And then a question, this is also for Rick, which is that somebody asked, so they have some seasonal employees within and without of Oregon. They have 2 here, 20 that are seasonal. Will they be covered under equivalent plans or the law in general?
They should be covered under equivalent plans as long as they are contributing employers. It's going to be really depend upon their employment, and that is something that we are currently looking at. But the way that we are interpreting the statute is that if they are employed or if they are supposed to be working and they cannot work because of a serious health condition, then they should be covered by equivalent or by PFMLI.
Caitlin, I have a couple questions. So folks are wondering about this 30 days in the equivalent plan part of the law, and they're wondering, so do they only meet 30 days of equivalent work with that employer? What about when moving to a different equivalent plan employer? How will that work?
Yeah, so we're still working. I'm trying to pull up my exact language of what the statute says, but it's continuously employed for 30 days is what the statute says on when an employer is required to provide coverage under the equivalent plan for an employee. And so we're still working on defining what does that continuously employed mean and the 30 days. We don't have it tied down yet as to if that is calendar days or working days or what that looks like for the 30 days. So we are working on that piece. And then I think you mentioned the 30 days and changing jobs. Can you repeat that part of the question?
So somebody asked if they're moving from one equivalent plan employer to another equivalent plan employer. Will that be, do they need to meet 30 days again or not?
Yeah, so the statute says that they would be immediately covered under the new equivalent plan if they're switching from a job with an equivalent plan to a new job with the equivalent plan. But what we just don't quite know is that there's not clarity around if they take time off in between those jobs. You know, there's not clarity around that. So we're looking into all of those specific situations. But in the clear cut and dry, I leave job A and then I start at job B on Monday. That one for sure, you don't need another 30-day window. Your eligibility would be immediate under the new equivalent plan.
Thank you. And my next 2 are actually for Lois. The first one is, when will the state's actuary announce the % of final wages to be split between the employee and employer, or to cap? And what is the cap again?
Well, the cap, of course, is 1%, no more than 1% of wages. And she is working on that now. She has gotten a lot of information from other states as to the types of databases and data sets that they use to make projections on how many employers are we going to have, how many employees are in various categories are actually going to take leave. And all of that information gets kind of synthesized into her making a projection of how much money needs to come in order to fund the program and have at least 6 months worth of benefits on hand, repay the general fund for the implementation, startup costs, all of that. We know that employers need to know this next fall so that starting January 1, they will be withholding and paying the right amount. So we're looking somewhere between the middle of next year and next fall, and then doing some kind of a major outreach program so that employers know that rate well in advance of the January 1 date. So I don't have an exact answer, but we know it's a range of time late next year.
Thank you. And Lois, what will happen if either the equivalent plan or the state plan has a shortfall of cash in order to make payments to people who need the leave?
Yeah, well, I mentioned that the projections that the state comes up with, that the employment department uses, is going to be projecting a 6-month solvency. If we ever get to the point where that is not looking like it's going to take place, like it's not going to be solvent, we need to go back to the legislature and tell them so. So that's kind of built in reporting to the legislature if at any time the plan does not look solvent. But at a certain point, if there is no money in the fund, then we can't pay benefits out. So we can pay benefits as long as the fund has assets. But once those are gone, and if the legislature hasn't enacted, then we stop paying benefits if the fund runs out of money. So the trick is on the front end, making sure that the contribution rate is high enough to provide enough for the benefits, but keeping it below that 1% cap.
Thank you. Caitlin, this one's for you. So do employers have to have an equivalent plan that encompasses all employees in their company, for example, part-time and full-time? If so, does that mean that they cannot pay into the fund for full-time and only pay into the fund for part-time?
Okay, that is a great question, and one that we've had already before this that people are wondering about. And so employers are required to make the plan available to all employees. And so the statute is clear about that. All employees who have been continuously employed with the employer for those 30 days. And at this time, we're recommending that to mean that an employer must cover all employees if they offer an equivalent plan, including full-time, part-time, etc., because it doesn't then allow for an employer to choose which of those employees they're going to make the plan available to. It does state all employees.
Thank you. And I'm going to take just about 2 more questions. And Lois, this one's actually going to be for you. It's about sick time and its relationship with this. So as the employer, we provide, I'm sharing someone's question, as the employer, we provide 10 hours of sick leave per month. The sick leave is carried over year to year, but cannot be cashed out at the end of employment. So if an employee goes out on family leave and then they get funds from the family leave insurance division, as well as get paid sick time from their employer's sick leave, are they able to get funds from both at the same time? I'm now just reading it correctly. So
Okay.
if their sick leave is available for regular sick leave and they also have access to, say, FMLA or OFLA, and I should say the Family and Medical Leave Act, which is a federal law, and the Oregon Family and Medical Leave Act, which is Oregon state unpaid but job protected Family and Medical Leave Act. So can you describe, I think, a little bit about how those are interconnected?
Well, I can tell you a little bit because each one covers some overlapping conditions and some do not. So sick time, for example, you could take sick time to care for a sick child for the day or for your own minor illness. That's not going to be covered under paid family medical leave because when it comes to medical leave for paid family medical, it has to be a serious health condition. And that's defined in other statutes that we refer to as a pretty serious health condition. So there will be times when people just want to use their sick leave because that's what it's there and it's designed for. When they get to the point of needing to apply for and take paid family medical leave, they will want to notify their employer that they plan to do so. And then depending on what kind of benefits they qualify for because of the amount of wages that they earned in their base year, they might not be making their full current wages. If they fall within certain parameters, they could get a full wage replacement, but it really depends on how much did they make in wages during that base year. So once the benefits are calculated, if they are not replacing their full wages now, they could still take other leave to which they are entitled. They can't have overlapping with unemployment insurance benefits or workers' comp benefits, but for other paid leave benefits from their employer, they could use that to supplement their income to get back to what their normal wages would be.
And so along that line, and this is going to be our last question, Lois, some folks are asking about how this exactly tracks with FMLA and OFLA. So can they take the paid family and medical leave insurance under their equivalent plan or the state plan, then they can take FMLA, then OFLA? How will this work?
That's a good question, and we are going to be working with other agencies that administer those so that we can line them up and people can see how are these plans similar and how are they different. Under the paid family medical leave law, if there is a leave purpose that correlates to Oregon Family Leave Act, OFLA, they must take them at the same time. But as I indicated, there might be particular types of leave that just don't line up. OFLA, for example, there's military leave. And that's not one of the qualifying purposes to take paid family medical leave. OFLA, you can use sick time to take care of a sick child. But remember, the big deal is that OFLA and FMLA are unpaid leave. Those are times that people can be away from work, but they're not being paid. For paid family medical, it is paid leave. So where they overlap with OFLA, definitely they need to take them concurrently. But there will be situations where there is no concurrence because there are different qualifying events, different qualifying family members, et cetera, between those two programs.
Fabulous, thank you. So we still have tons of great comments and questions. We didn't get to them all, but thank you so much. And thanks everyone for answering those. Again, as a reminder, we're recording them. You can always give us feedback. You'll see again in the chat the email that you can contact us. Back to Dean.
Lily, Lois, Caitlin, all of those with our work groups, thank you guys so much for sharing your expertise that you have in the program with all of those that were in attendance today. Myself and as well as all of those that are here, I know appreciate it. So with that is all the time that we have. We actually went a little over today just because we had some great questions and stuff. And so really just can't emphasize enough just how much we here at the Paid Family Medical Leave Insurance Program want to thank you all for your great input and your great questions as we work to really help build and implement this program that will benefit all of Oregonians. And so today, again, as Lily had mentioned, the equivalent plan meeting, it was recorded. So if you'd like to go back and watch this, share it with a friend, another employer, your employees, please feel free to do so. It will be posted to our PFMLI webpage here within the next few days. Right above that is our contributions town hall. It's already posted there. So if you missed that town hall, please feel free to go and check that one out with regard to contributions, as you may have had some contributions questions that are answered during that town hall. And as Lily had mentioned, and as we've mentioned, really during this meeting, we're always taking feedback. So if you think of another question, comment, concern regarding paid family and medical leave, please do not hesitate to reach out. You can submit those at paidfamilyandmedicalleave@oregon.gov. And also, don't forget to sign up for PFMLI updates. And also, if you haven't registered yet, we do have another town hall coming up on November 9th. That's a Monday, and this town hall is at 6:30 p.m. So a different time and day than both today's equivalent plans town hall as well as the contributions town hall. So again, next one, benefits, is going to be on November 9th at 6:30. Again, thank you all so much from all of us at PFMLI for your time today. Thank you.